Hello, namaste all. I am Dr. Vaishakh Anand. I'm a consultant pediatric neurologist working at Amrita Hospital, Kochi, Kerala. So the question asked today was, is epilepsy curable? As a pediatric neurologist, as an epileptologist, I hear this question very often from my patients. So the direct answer is yes in most of the cases, but depending on what type of epilepsy you are having. So when we talk about cure in epilepsy, it's basically the control of the seizures. So everyone knows that epilepsy means it is the seizures, recurrent seizure occurrence. That is what is a characteristic feature of epilepsy, so-called. It's a neurological disease. Also, everyone knows that. So regarding the management of seizures, basically there are 2 to 3 options that we have. Out of that, the first option is medicines. We know that there are many types of medicines for seizures, which we commonly call as anti-epileptic drugs or AEDs. There are more than 20 or 25 types of drugs available in the market for seizure, for controlling the seizure. And depending on your age, depending on the diagnosis that you have, depending on your other comorbidities, your sex, many features, depending on many factors, your neurologist will be deciding on what drug you need to be started on. So typically we say somebody is cured of the epilepsy or out of epilepsy when they're seizure free for 10 years at least and they're off seizure medication for 5 years. Then we say that the epilepsy is cured. Another situation is there is somebody is having an surgery amenable epilepsy, like in the brain there is a particular lesion which is leading to seizures, and that lesion is resected through epilepsy surgery, and the seizures gets controlled. Then also we can say that they are out of epilepsy or their epilepsy has got cured. But in every case, epilepsy may not be cured completely. That depends on case to case basis. So in some cases, especially I'm a pediatric neurologist, I see children most of the time. So there are many epilepsy types of epilepsy or epilepsy syndromes that occur in children, which they can outgrow. Like there will be a particular age group at which this epilepsy will be happening. And once they cross that age group, they are out of that danger. And after that particular age group, if they are seizure free, there is no need to continue the medicines. And we typically say that the epilepsy is cured. Now, the other question was, what are the treatment options for seizures or the epilepsy? So, as I mentioned, the most commonly used, widely used treatment modality is anti-seizure medications or anti-epileptic drugs that we call as AEDs. There are many drugs, and depending on your condition, doctor will be choosing the right one. In some cases, children or the patients may need 2 or more seizure type medications. If one anti-seizure medication is not sufficient or it's not working or it's having some side effects, then doctor may typically stop that or along with that start another drug. So like that, that's how we treat the epilepsy for the control of the seizures. Now, so in particular situations, in some conditions, this it may not work. The drugs may not work, and despite 3 or 4 drugs, the patient or the child may be having recurrent seizures. In such conditions, we consider what's called as an epilepsy surgery. So, epilepsy surgery, as you know, it's a major surgery. It's a neurosurgery, like you need to open the brain and all. So, it's not done in all cases. Only in typical cases, only in drug refractory cases, it will be done. Or in some cases where there is a particular lesion that's causing the epilepsy, in such cases also epilepsy surgery may be done. So with medicines up to 70, the studies have shown that up to 70 to 75% of cases with epilepsy, with drugs, it may not be one drug, with 2 or 3 drugs at least, 70% of cases will be getting control. But in the rest 30%, it may not be working. So in such cases, we will be considering epilepsy surgery. So again, epilepsy surgery, there are different types of epilepsy surgery depending on what type of disease you are having, what's your MRA, what's your EEG, many factors comes into picture. Another question that was asked was, can somebody lead a normal life? Now, again, the answer is perfectly yes. Epilepsy is not a disease which is like it will be affecting the life in all cases. In some cases, the person's personal life and day-to-day life may be affected due to recurrent seizures, but that's not the case in majority of the cases. In majority of the cases, for the patients, for children, they will be able to carry out their day-to-day life. They will be able to go to school. They will be able to perform all the activities that their peers can do without any inhibition or without any restrictions, provided your seizure is well controlled, either through medicines or through other options like epilepsy surgery. Now, apart from epilepsy, the epilepsy drugs and epilepsy surgery, there are other modalities also that we can use to treat seizures. Out of there, one is something that is very getting popular nowadays. That is ketogenic diet or dietary therapies. Ketogenic diet basically means that It's a kind of diet where the carbohydrate. We all know that the particular typically the Indian food, almost 50 to 60% of our Indian food contains more of carbohydrate. Whereas in the ketogenic diet, what it happens is that the carbohydrate content of the diet is reduced to very minimal level, and instead we'll be providing more protein and fat. So it's basically a low carb, high protein, high fat diet. And while providing this type of particular diet in the body, there's something called ketones will be generated in the blood, which is kind of an anti-epileptic a chemical with an anti-epileptic action, which can reduce seizure generation. So that is why this particular diet is called as a ketogenic diet, because it produces ketones in the blood. So this particular diet is without any major side effects, minimal side effects only, like some abnormal GI disturbance and all. That's it. Otherwise, it's a very well proven treatment option for cases of epilepsy, which are not controlled only with medications. Another treatment modality is something called as a neurostimulation, out of which the most common one used is vagal stimulation. So there's a nerve called vagus nerve, which is one of the longest nerves in the body. So vagus nerve stimulate when gets stimulated, it can also reduce seizures. So that also is used. This all may be used differently or combined or along with other modalities depending on what epilepsy or what surgery you have, what condition you are having. Now, as I mentioned, most of the children with epilepsy can lead a normal life. So, in the initial period, somebody when gets diagnosed with epilepsy, initially we tell them that till the seizures get controlled, like at least for 3 to 4 months, better avoid contact sports or sports where danger can happen, like swimming and all. Or if children, we ask them to do that only under the adult supervision. Once the seizure is controlled or the epilepsy cure, you can go ahead with whatever activities you like, and we don't typically ask them for restriction. Thank you.